Well, hello everyone. Good morning and welcome to the session on the Mental Health Commission of Canada's National Action Plan on Mental Health and Criminal Justice. My name is Anna and I'm joined this morning by my colleague Sarah. We are your facilitators for the session. Before we get into the content of the presentation, some housekeeping notes. You can use the chat feature at the bottom of the screen to submit questions. The presenters will be speaking for about 30 minutes and then we'll open it up for discussion. Until then, please ensure your microphone is on mute. We are also recording the session, so you will be able to access the recording on the platform for 90 days following the conference. A reminder that there will be a short evaluation that we'll share in the chat near the end of the session. Your feedback is appreciated, so please do fill it out. And lastly, in the spirit of the conference and its theme of creating inclusive spaces, we invite you to engage with each other and the presenters thoughtfully, considering the impact of your words and interactions on others. With that, I'd like to welcome our presenters this morning. We have Nikki Kish with the Canadian Association of Elizabeth Fry Societies and Crystal Kelly with the Mental Health Commission of Canada. Take it away.
Thank you, Anna. Good morning, everyone. We are really pleased to have an opportunity to speak to you today about this work to develop an action plan for Canada on mental health and criminal justice. And we're going to just get started with a land acknowledgement. So I do want to acknowledge that the Mental Health Commission of Canada's main offices are located in Ottawa, which is the traditional and unceded territory of the Algonquin Anishinaabe peoples. And as a national organization, we also acknowledge that we work on the traditional lands of many different nations, and we are grateful to have the opportunity to connect virtually, and then we get to enjoy living and working on this land. And this recognition really means that we endeavor to infuse cultural safety and humility into our work and ensure the voices and experiences of First Nations, Inuit, and Métis peoples are heard and listened to, and that these perspectives are reflected in the development and implementation of this action plan. And we are making efforts to meaningfully engage with First Nations, Inuit, and Métis organizations and contacts throughout our engagement activities so that these voices are reflected in the action plan, and to explore how this action plan can and should support the implementation of the United Nations Declaration on the Rights of Indigenous Peoples in Canada to help address the over-incarceration of Indigenous peoples. And I would like to note that today we will be discussing some sensitive topics, such as mental health, and we want to ensure that you have supports available to you should you need them. So to make this easier, we have listed some resources on the screen that you can access if you feel the need to, and I'm just going to paste them in the chat as well so you have them there when we move to the next slide. And then, we've already were introduced really briefly, but just a reminder that my name is Crystal Kelly, and I'm a program manager at the Mental Health Commission of Canada, leading our work to develop an action plan on mental health and criminal justice. And I have been working at the Mental Health Commission of Canada for almost 5 years now. And it's just really exciting that, when I first started, we were kind of doing what we called scoping work in the mental health and justice area. And now to really have that evolve into an action plan is really exciting and a great opportunity. And I'm really pleased to be joined by Nikki Kish today. So I'll pass it off to Nikki to introduce herself and talk a little bit about her work.
Thanks, Crystal. Thanks everyone for coming today. My name is Nikki Kish, she, her pronouns. I'm joining today from the unceded Lekwungen Territory, or Victoria, British Columbia. And I work with the Canadian Association of Elizabeth Fry Societies. We've operated since 1978, providing critical services for criminalized women and gender diverse people. We've been working with the Commission and with Crystal since 2020 on this action plan, so we're so happy to be involved and to be here today. And I'll just briefly share a little bit about Kate's work. So our vision is a world without prisons, with strong and well-resourced communities for everyone. We approach everything we do from an intersectional feminist rights-based lens, and this requires us to be attentive to the fact that transforming persistent forms of harm that impact criminalized women and gender diverse people require considering and addressing the mutually intertwined and overlapping ways which justice processes impact all populations. And I'll speak a little bit about CAFES in Ontario. So in the Ontario region, we have 8 specific Elizabeth Fry societies, and each society works independently, providing various frontline services. services pre, post, and during incarceration. The societies both work independently and work in collaboration with one another. Through the Council of Elizabeth Fry Societies of Ontario, these 8 societies enter prisons, provincial prisons designated for women in Ontario, monitor the conditions of confinement, and work to identify supports that they can engage in and develop. And all of the societies in Ontario and across Canada are part of CAFE's wider network. So I'm with the National Office of CAFES, and we oversee membership to all Elizabeth Fry societies across Canada. As well, we maintain a national office that engages in public awareness, legislative and policy advocacy work. And again, so happy to be here today. I'll pass it back to you, Crystal.
Thank you, Nikki. So here's just a short summary of what we will cover today. So I'll start off by sharing some highlights from the Mental Health Commission of Canada's work to date in mental health and the law since around 2012. And then we will introduce the action plan and talk a little bit about why did we decide to take on the development of the action plan and what is the scope. And then we'll share a bit about our approach and activities that we've been taking to inform the action plan. And then we'll be sharing some very high-level preliminary themes that we've been hearing to date. And then there will be an opportunity for discussion and questions afterwards. And we do have a few questions that we will be posing to everyone to get your input on. So a little bit about the Mental Health Commission of Canada. So the MHCC was created by the Government of Canada in 2007 to develop the mental health strategy for Canada. And this was released 5 years later in 2012. And the strategy includes a number of priorities and recommendations that we are continuing to work with to guide our efforts and our work. And at the Mental Health Commission of Canada, we lead the development and dissemination of programs and tools to support the mental health and wellness of Canadians, including, the development of this action plan, which is a focus of our session today. And as an organization, we are supported by funding from Health Canada, partnerships with federal, provincial, and territorial governments, foundations, private sector organizations, as well as donations from the public. And we are a national not-for-profit corporation and a registered charity. And we offer accessible training programs that support mental health in communities and workplaces, as well as lead research and initiatives that emphasize people-centered values like lived and living experience. And some of the programs that we work on are suicide prevention, stigma and discrimination, access to high quality, culturally appropriate mental health services, workplace psychological health and safety, as well as substance use health, just to name a few of our other projects that we work on. And as I mentioned, the mental health strategy was released in 2012, and this is really the foundation that provides guidance for all of the work that we do at the Mental Health Commission of Canada. And specifically, Priority 2.4 provides broad direction for Canada to reduce the overrepresentation of people living with mental health problems and illnesses in the justice system, and to provide appropriate services, treatment, and supports to those who are in the system. And it has really been our role to work with experts and stakeholders across the country to figure out how best to do that, given various realities, limitations, and needs, as well as opportunities. So since the release of the strategy, we have been involved in work related to mental health and the law, and I've listed a few key milestones on the slide. I will highlight that since 2019, mental health and criminal justice has been an area of greater focus for the Commission. And in our previous work plan, we did some scoping work where we sought to identify where there are major gaps and barriers in mental health and criminal justice in order to better understand, if there was a place for the Commission where we could amplify support or lead work in this area. And this work did involve a scoping review on the mental health needs of justice-involved people, which then led to a national forum in March 2020. So right before the pandemic and everything got closed down, we actually met with some experts in Winnipeg, and we really heard about the need for an action plan in this area. And we heard that the MHCC would be welcome and well-positioned to take a leadership role in developing an action plan. And during the scoping work, I just want to highlight that we also published a national inventory of mental health and substance use services and supports for people transitioning out of the justice system. And at the end of our session today, we will share a link where you can access many of the resources that I just discussed, as well as some that we'll be discussing a little bit later on in the presentation. So all the work that I mentioned has really led us to where we are today, leading the development of an action plan for Canada on mental health and criminal justice. And the action plan builds upon our previous work in this area and was inspired by continuous calls for action to produce meaningful change. And on the next slide, we will hear from Mo Kurczynski, who is one of our advisory committee members, a person with lived experience, and the executive director of Unlocking the Gate Services Society, which is a peer-led organization that supports the reintegration of individuals who are being released from correctional facilities in British Columbia.
I've been doing this for 15 years. People ask me for my opinion. What can we do to make things better? And then it sits on a desk and it stays in a report. I just want to see action. I guess I just want to see change.
So as you can hear from Mo, there are a lot of strong advocates engaged in this work who just want to see change. And one thing that we keep hearing is that we don't just want another report that will sit on a desk. So we're really trying to, make sure that that's not going to happen. And really these repeated calls for action are what inspired this initiative to develop the action plan. And I'll now pass it off to Nikki to share a little bit about the scope of the action plan and our committee.
Thanks, Crystal. So the development of the action plan is supported by a development advisory committee, of which CAFES is a member, and it's comprised of over 20 members with various backgrounds and expertise, including people with lived and living experience of involvement in the justice system, mental health concerns, individuals working in the justice system. This includes law enforcement personnel, legal professionals, the union representing correctional officers, organizations providing supports to justice-involved individuals, organizations providing supports to victims and survivors of crime, organizations and individuals representing Indigenous perspectives, expertise in prison health, victims' rights, health, substance abuse, researchers, and academics. And we want to highlight that the focus of this action plan is not just those who are system involved, such as those who are experienced and such as those who have been incarcerated or continue to experience incarceration, but all of the groups who interact and are impacted by justice processes. When we were in the early planning stages for the action plan, we heard that the scope should be broadened to focus on the psychological health and safety of people who work in these systems and those who work peripherally but are still directly impacted. We heard from key stakeholders that the perspectives, experiences, and voices of victims and survivors of crime, as well as everyone impacted by the system, including all of the communities who work with individuals and children and family members, also must be included and reflected in our action plan. So we're working very hard, as Crystal mentioned, to include the voices and perspectives of First Nations, Inuit, Métis people as priority populations, LGBTQ communities, African, Caribbean, and Black communities, older adults. Essentially, we want the action plan to include as many diverse perspectives as possible. And it's important to emphasize up front that the impacts of the justice system in many ways overlap across these perspectives. And we've identified 3 main priorities so far in this action plan, and we'll invite you into discussion about them in a little bit, but they include upstream prevention and early intervention. So identifying programs and services that fall outside of the justice system and in the community to prevent ultimate involvement. The second priority is supporting mental health across all types of justice involvement. And so we're looking at the mental health and substance use needs and programs and models and services throughout the justice system and its various institutions. And the final priority we've identified is structure, law reform, and systemic transformation. And this priority looks at how laws, policies, and structures can be improved to better support mental health outcomes in the justice context. So there are 5 cross-cutting considerations that we've identified. And these are areas that don't necessarily fall into one of the priorities mentioned, but have implications across all 3 of them. So the cross-cutting considerations are consideration of Indigenous peoples, communities, methodologies, Indigenous principles and rights, priority populations, and I'll discuss this further on the next slide. Broader societal issues, social context, and this includes systemic racism, the overdose crisis, housing and affordability crisis, ongoing impacts of the pandemic, all of these broader social considerations that directly impact the scope of this action plan. As well, a cross-cutting consideration of the impact of stigma and public perceptions of people who are justice involved, a recognition that justice involved individuals experience multiple stigmas, mental illness and substance use, and finally, a consideration of the socioeconomic determinants of health and health equity, including things like education, employment, and access to health services. And so we've identified 12 priority populations in our action plan with input from all of our various stakeholders. And you can see them all listed on this slide. We acknowledge in identifying this list that it's not exhaustive. We continue to hear of groups who have unique needs and require specific supports. These groups have been highlighted for inclusion and consideration in the action plan, with a recognition that other groups will be identified and emergent, as well of the impacts of intersections of groups where individuals experience overlapping membership to various priority identities and unlisted identities. And we're paying close attention to the needs of intersecting identities and how to better understand how people with overlapping priority identities are impacted, both in justice processes and in their likelihood to become justice involved. And I'll pass it back to Crystal.
Thank you, Nikki. So the development of the action plan is unfolding across 4 phases. And right now we're in phase 2 of development, where the focus is really on informing the action plan through various research and engagement activities. And I will talk about some of those activities on the following slides. And I do want to mention here that there is some overlap between the phases, and we are now starting to pull together some of the issues, themes, and recommendations that we've been hearing to date to help get us started on drafting the action plan in phase 3 as we move into 2024. And then in phase 4, the action plan will be released alongside some promotion and knowledge dissemination activities. So we do have a survey that is live right now, so I'm just going to put a link to the survey in the chat before I forget. But this is one of the pieces that will inform the action plan, and it was developed in collaboration with our project advisors and advisory committee. And the survey is just one of our engagement activities, but it's really intended to broaden outreach to hear from diverse perspectives with knowledge and experience in mental health and criminal justice. And we hope that the survey will allow us to hear from people we may not otherwise be able to engage. And I do know that the survey was previously shared with the provincial HSJCC members, so you may have already seen it come across your inbox. And we are happy to share that we've already received, I think, almost 1,000 responses. That includes both partial and complete, but a really great response rate so far. And we've been assessing where there may still be gaps and where additional focused outreach is needed. So we've been doing some intentional outreach with First Nations, Inuit, and Métis organizations and communities, people living in rural and remote communities, people with lived and living experience of justice involvement, as well as Francophone organizations. And the survey is actually closing next Wednesday, November 22nd. So it's just under a week away. And we encourage you to complete the survey and share it with your networks to ensure that your perspectives are captured among the survey responses and aim to be reflected in the action plan. Then another activity that will help inform the action plan is a multi-stepped research project that is looking at national and international frameworks and strategies on mental health and criminal justice to identify promising practices, gaps, and opportunities that we can build on for the action plan, but also looking at previous frameworks and strategies, like what were the barriers to implementation and perhaps why they haven't been implemented. So the first step of this research looked at frameworks and strategies addressing the mental health needs of justice-involved individuals within the criminal justice system. And this work wrapped up in June. And then right now we're working on the second step, which is focused on the psychological health and safety of individuals who work within or those whose work directly relates to the justice system. And this second step was informed by the search strategy and learnings from step 1. And it is expected to wrap up in early 2024. And then this slide here just shows how all the key activities in phase 2 are coming together to inform the action plan. I only touched on a couple of these activities today for the sake of time, But I did want to highlight that there are various research and engagement activities that will be feeding into the draft issues and recommendations for the action plan. And then those will need to be refined and validated before a final version is available for release. And we are also working on developing an evaluation plan so that the development and implementation of the action plan can be evaluated after it is released. So now we want to take some time to share some of the preliminary themes that we've been capturing to date from various sources. So this includes, high-level findings from that first step of the research that I mentioned, but also from our committee, our working group meetings, as well as a lot of conferences that we've gone to. So in a little while, we will be asking for your input on a few engagement questions, and we really will be taking your input and feeding that into the action plan. And I do want to note that these are very preliminary themes, and we're going to continue building these out and refining them as more information becomes available from our other research and engagement activities. So on this slide, we see some of the preliminary themes related to the priority on upstream prevention and early intervention. So this is just a high-level overview, but some of the themes that we've been hearing is that lack of funding is an issue, and I think we're all aware of that and hear that very often, that most agencies providing services are underfunded, and this leads to staff burnout and long wait lists. And we've been hearing that funding arrangements need to be reviewed and improved, such as, the annual contracts and little to no capital dollars, so that needs to be reviewed. We've also heard that there is a lack of awareness from the general public around what services and supports are available, and a lot of people are unaware of where to seek help. We've also heard that there are several issues with accessing health and mental health care. These include mental health services are non-existent in many communities, especially rural and remote communities. There are a lot of long wait lists for services. There's also a lack of capacity among community-based services to provide support. And there are also a lot of barriers to accessing mental health services. For instance, oftentimes these services do require a referral or diagnosis from a family physician, which is a big barrier for a lot of people. And we've also heard that there is a little bit of a lack of understanding or knowledge among workers. And what we mean by that is there's not enough training for those who work in the community. And there is a lack of knowledge among healthcare providers about, certain illnesses or conditions, such as fetal alcohol spectrum disorder, and how that really relates to mental health, as well as justice system involvement. And then on this slide, these are the themes that are related to supporting mental health across all types of criminal justice involvement. So here we're looking at, kind of first contact with police all the way up to reintegration. And some of the themes that we've been hearing is that, the justice system is often used as a first response to those who are living with mental health concerns or illnesses and substance use related issues. However, the justice system is not the right environment to provide care because incarceration is traumatizing and harmful, and it often worsens people's mental health. I've also been hearing that there's a lack of diversion opportunities, or what we call off-ramps, from the criminal justice system. So there are limited meaningful options for alternatives or diversion from the justice system and incarceration. And there needs to be options for people to leave the justice system permanently. There's also a need for early assessment of mental health needs and early intervention when individuals do enter the justice system. And consistent mental health supports are required at all stages of justice involvement. And something that's really important to emphasize is that supporting mental health should not follow a one-size-fits-all approach. So we really do need distinctions-based programming. Another thing we've been hearing is that time in custody really should focus on rehabilitation, reentry, mental wellness, and education. And lastly, we've been hearing that development and dissemination of comprehensive education and training for staff about mental health is needed, but education and training are not enough, and it should not be a substitute for a health-centered response. So really want to emphasize that. And then relating to our third priority on structural law reform and system transformation, we've been hearing a lot of recommendations pertaining to this one, but I'll just highlight a few. So the first is that the not criminally responsible provisions under the criminal code are long overdue for an overhaul. So some suggestions that we've been hearing include putting limitations on the length of time for detention and that less serious offenses should be diverted rather than allowed to proceed to trial and attract a verdict of not criminally responsible. We've also heard that there needs to be changes to federal, provincial, and territorial health policies and legislation. One recommendation that we've been hearing a lot is that laws should be changed so that provinces and territories are responsible for administering healthcare in provincial and territorial facilities. And we know that 4 provinces are currently providing services under their respective Ministry of Health, such as Nova Scotia, Alberta, British Columbia, and Newfoundland and Labrador. And we've also been hearing that there is a need to revisit provincial and territorial mental health acts and to kind of review these in relation to the charter and human rights legislation and kind of revisiting all of those. We've also heard that changes to the criminal code are needed to include much more emphasis on rehabilitation. So one suggestion has been to completely rework Section 718 on the purpose and principles of sentencing. And we've also been hearing about the need for improved data collection and better metrics and race-based data. And I will say this is one of the themes that we've been hearing very frequently, and that there is a need for the implementation of policies to allow for sharing of data sets across provinces and sectors, but also making sure that there are safeguards in place when sharing this data so that, that it's not being shared with everyone and that it's being used in a meaningful way and not being used against the individual. So this is something that's also very top of mind. And there was a suggestion to implement standards of regulating data and what information is being collected and kind of what safeguards do need to be in place if we are sharing data. And then lastly, we want to highlight some of the themes that we've been hearing pertaining to the psychological health and safety of criminal justice personnel or people who work within the system. So these include themes such as, workplace culture and structural barriers do have a considerable influence over psychological health and safety. For instance, we know that criminal justice personnel are exposed to traumatic events, either directly or vicariously through their clients. And this can lead to compassion fatigue, staff burnout, turnover, and stress. And trauma is often seen as part of the job. So we've been hearing that one recommendation is that this normalization of trauma being seen as part of the job really needs to be challenged, and it is important to provide appropriate resources and supports for criminal justice personnel after a trauma has occurred. We've also been hearing that there is a need for access to a full range of services and supports for criminal justice personnel, including peer support and specialty services. And I do want to emphasize here that, workplace programs are not enough because these are individual solutions to structural problems. So while individual interventions such as training and education do have value, it is crucial to remember that these individual solutions cannot replace comprehensive organizational policies and support. And these solutions unfairly place the onus on individuals in the face of complex social, cultural, and structural barriers to a healthy and safe workplace. So I just wanted to emphasize that. And some system level strategies that we've been hearing that are needed include, addressing chronic underfunding and understaffing, providing comprehensive employer funded mental health services, implementing strategies and interventions to reduce exposure to workplace violence, as well as embedding specialized mental health clinicians in workplaces to support staff, especially where staff are being kind of exposed to trauma on a daily basis. Like really having access to a specialized mental health clinician would be really helpful. So I think that's it for the preliminary themes. I know this was like a very high level and quick overview. But I think now we wanted to get into a discussion about these themes, and we can definitely flip back throughout the slides if that would be helpful. But we want to hear from you, if you think these themes, do they resonate with you? Is there a particular theme that should be emphasized? What's missing? And is there anything you disagree with? Because, we want to hear all perspectives. So, please feel free to raise your hand or kind of share some of your feedback in the chat. Maybe, Anne, if you want to just like flip through the slides, maybe we'll go to upstream prevention just so to remind everyone of some of the themes that we have been talking about, recognizing that I was, going through it really quickly. I see that we have a comment in the chat about peer support and how will it work. So I'm not sure, Michelle, if you wanted to expand on that, but yeah, we definitely have been hearing peer support and how that needs to be implemented, you know, through upstream prevention, supporting people when they are in the system. So yeah, I think peer support is definitely really important, and we've been hearing that a lot throughout our work. I'm not sure if you wanted to expand on it, but.
Sure. I just wanted to make note that peer support, like with lived experience, one of the barriers is that they have a criminal record as well. So how is that going to affect the program? Because it's a huge barrier.
Absolutely. Thank you for pointing that out. And that is something that we've been hearing. So I think that's something we'll take back and have to consider. But I think, you know, that is a huge barrier and something that we'll need to overcome. And also we've been hearing things like, you know, peer support workers need to be compensated adequately. So that's something we've been hearing. And, you know, to have access to training if they would like it, and all of that. So I think that's really important. I'm not sure, Nikki, if you wanted to add anything. I see you nodding.
Sorry, I'm a big nodder. Yeah, you know, so our organization, CAPES, we focus on a lot on peer support programs, and we also track their history, especially as it pertains to people who have been incarcerated. So we hire intentionally, looking for people who've been justice involved, but we do so really cautiously because we recognize, I mean, in frontline service provision, whether it's peer support or anywhere in the spectrum, people are experiencing ongoing trauma and vicarious trauma. And when you've already experienced the harms of incarceration, this adds so many complex layers for us to consider as employers. Traditionally, in the history of peer support in Canada, at least in federal incarceration, there has been a reliance on volunteer labor, which of course, you know, exacerbates these problems in ways that are really unsustainable, and then compounds the burnout and leads to a high turnover. Stigma is a persistent problem we face. So we work a lot with like senior officials in the Correctional Service of Canada, especially in public safety, to collaborate on staff training, to recognize the benefits, because there are huge benefits when you get individuals who have been incarcerated, supporting individuals who are currently, this is a focus of Mo's program, Unlocking the Gates in BC. She takes people right upon release. The benefits are tremendous. It really works. And so, yeah, we're working as hard as we can to understand what it needs to work better and then build it.
Thank you. So I see, Trevor, you have your hand up.
Yeah, one issue that I would mention would be that at least here in Ontario, the great difficulty that people with mental health diagnoses have in getting on Ontario disability, which of course then, if they can't get on proper income support, then puts them in a very precarious situation as far as basic survival goes. And the reason being that because they have a difficulty in proving that their diagnosis is permanent, and because of course mental health issues can come and go, and so it's difficult to get a diagnosis, especially if you don't have a doctor that is your own sort of permanent family doctor, or a psychiatrist that works with you regularly. So that puts people into a position where that can obviously get them into a position where they don't have a regular income as well. So then they wind up possibly in the justice system or in the forensic system. So that's certainly something I would add to for a theme, is precarious income. One thing that I was curious about, this is something that I saw this presentation 6 months ago at the provincial HSJCC meeting, and I asked about it then, and so I apologize, I'm asking again 6 months later. There was a graphic showing about the different phases and everything, and one of them has to do with eventually evaluating how this is implemented. There seems to be skipping a step about how it's actually going to be implemented, especially considering this is primarily provincial responsibilities. Almost all of this falls under the auspices of the various provincial governments, whether it's healthcare or corrections or courts or all of that. Much of it comes under provincial jurisdiction. And so I'm just wondering what you have in mind in terms of getting any of this actually acted upon.
Thank you, Trevor.
The
These are all
action and action plan, basically.
Thank you. No, this is a great question, and we get it a lot, and something that's definitely top of mind because, a lot of people say like there is no like authority of the Mental Health Commission to make people like have to do it, right? So I think a big thing for us is really getting that buy-in, and right now we're thinking of a strategy right now to be meeting with all the different ministries for like justice and health, public safety. So that's like a big part of it. That we're working on and kind of working on that plan right now of what will implementation look like. And then in the action plan, we will be trying to make it very specific, operationalized recommendations, because we've heard before, like if you have vague recommendations, no one's going to do it. So it's going to be very directed on, who should do it, what should it be, and also kind of like giving a roadmap of how it can be implemented. And then we will be taking a little bit of a role, I think, afterwards, trying to make sure that it has been evaluated. So we're working on that evaluation framework right now and seeing like what our role could be in that too. Once it's released, reaching out to organizations and seeing like, have they read it? Have they implemented it? How can we support them in implementing it? So right now we're really trying to plan all of that out. And I don't have like, a full-fledged answer for you today, but that is top of mind. So thank you for bringing it up. And something that we're trying to work on now is what will our implementation plan look like?
Thank you.
I see we have some comments in the chat. One of them was just saying, thank you for all the information. And I think it's critical to look at themes from a perspective of order. For example, we need to address antiquated legislation, law reform, and funding to further evolve some of the other priorities and strategies. And absolutely, I agree with that. I feel like the structural law reform and system transformation is the biggest priority, but also the most important, because a lot of the things that we want to change, we can't change without changes to these structures and the legislation. So I think that's definitely very important. And I see, Alyssa, that you said you were surprised but glad to see a section regarding those working within the justice system. And sometimes it can feel selfish and make us feel guilty to focus on us rather than the folks we serve. But it's so important that personnel are well so that we can continue supporting the people in our community who need it. And then Jenny was also just talking about, trauma-informed organizational leadership and implications of that. And I think that's so important, and something that we heard early on, because admittedly, when we started mapping out this action plan, it was really focused on justice-involved individuals. And then we heard, like the staff and workforce piece is just as important. So that's definitely like we're paying just as much of attention to that. And we agree that, you can't, we've heard this analogy a bunch, is that you can't have like healthy people who are in the justice system if you don't have healthy staff, because they're so intertwined. So that's something that's been top of mind as well. I'm not sure, Nikki, if you wanted to comment on any of these.
No, it's a really great and important focus. I agree, and we'll move to the priority populations next. But while it's really important to understand the distinct challenges different groups face, it's really also important to not consider impacts in silos. And so what we see is that adverse impacts, elevated risk of addiction and mental health impacts and all the harms that occur to justice-involved individuals occur across the stakeholder groups. So people who are incarcerated, people who administer incarceration, they're really shared, and there's a lot to be learned in that. Oh, thank you, Anna. And I see that we've moved back to the priority population slide. I did not mean that as a segue, but I appreciate it. And so if everyone could just take a second again. Developed priority populations, with an emphasis that, we're very committed to understanding how characteristics of membership within these populations create distinct impacts, but also with attention to overlapping impacts and the ways that intersections of identities can be overlooked and can be harder to understand. So these again are the groups that were included initially or emergently over time for consideration. And we want to continue to hear from you and from everyone in the survey results and in our ongoing committees about groups who aren't recognized in this, about framings that might be important to consider or reconsider, and to consider the intersectionality. So our next question, or discussion, if we can, ask you all your thoughts. Oh, you know what? I'm sorry, I skipped a slide. First, I'll take you through the preliminary themes we've learned from the priority populations, and then we'll ask for feedback and engagement. So having identified these 12 populations, we see across them all common issues, and we have shared proposed solutions that hopefully are relevant across the populations. And so some recurring themes include, again, as a strong lack of research, data, and metrics related to priority populations in justice and mental health systems. So demographic specific information simply is not recorded, especially in the continuum. There's an opportunity and a need for research looking at the disparities of approaches used for different priority populations. Again, a need for race-based data. Priority populations are experiencing several barriers to accessing health, justice, and social services. Right now in Canada, 50% of women who experience incarceration are Indigenous. There's a very, very urgent need to look at the ways in which the justice system is impacting people differently. But then bringing in that intersectional lens, socioeconomic barriers transcend justice involvement. So most people who experience incarceration, of course, have very precarious economic situations, often precarious housing. This brings us back to the cross-cutting consideration of the social determinants of health, racism, societal discrimination, how who a person is shows up in sentencing regimes and ultimate outcomes in justice processes, biases that lead to communities having mistrust and reluctance to access services and early interventions, even computer, internet, and telephone barriers for many of the priority considerations we've learned have direct outcomes on ultimate involvement. And those are, oh, I'm sorry, I forgot one more. Mental health is not considered in the same way, of course, for different cultures, and recognizing that it has different meanings. So developing a program that's culturally relevant, but I'm not sure if anyone read the recent Office of the Correctional Investigator report, but also understanding that in developing cultural competencies, that blanket approaches, such as like pan-Indigenous considerations, are also risking having gaps and shadows. So there's a high level of not a blanket, not one fits all approach, and recognizing the nuance and the people-centered approach as hopefully a best practice to move forward. So we've posted a question to you for us to discuss, and that's, how do you see intersecting identities showing up and impacting people's experience to either interact with the justice system, or for various stakeholders groups, all of the people who are including who are justice impacted, people who are administering incarceration, victims and survivors of crimes, how do everyone's intersecting identities impact involvement and outcomes?
Does anyone in the chat want to share some thoughts or maybe come online about this first discussion question? I know there's a really amazing and powerful session happening right now on the impact of racism on individuals' mental health, and maybe I don't know if if Crystal and you want to start us off, and maybe some others will join the chat. But my colleagues have just been messaging me about this panel and sort of, how just racism itself can actually lead to some pretty significant mental health issues.
Thank you, Sarah. Yeah, I saw that session was kind of happening at the same time, and I was disappointed I couldn't attend, but we'll definitely be looking kind of at all of the recordings after. And racism is such a big part of this action plan. I feel like we hear it, like people say, the action plan can't itself address racism, but it has so many implications for the justice system. So we're very mindful of that. And, we've been having discussions with the committee about how it impacts people's experience of mental health issues, of, the justice system. So that's something that we're definitely keeping top of mind. Jenny?
Good morning. Back to your point about the really the systems level, the legislation, the structural elements, because if we don't start to decolonize those aspects of the work that's happening, we won't see a justice system that's reformed or treating individuals who come with intersectionalities differently. I think it's really just that macro focus is a place where there needs to be a lot of disruption and redesign in order to really change the vulnerabilities and risk factors for individuals who are, facing multiple intersectionalities.
Thank you, Jenny. That's an excellent point. And I think something that we've been hearing is we really need to look at, the legislation and the structures and what needs to change there. And like you said, kind of like just dismantling a lot of the systems that we have. So that's something that we're definitely looking at. And Nikki, saw you came off mute, so I'm not sure if you had something to add.
No, I just wanted to recognize, like Crystal and I reflected, that we're sharing a ton of information. So I don't know if anyone's like me where I think of everything 10 minutes after the fact, but please see this as an invitation to continue to be in dialogue and discussion with us. And we'll love to hear your thoughts anytime after this presentation as well.
Absolutely. And maybe we can just also go to the next question, just because I know this is a bit big and very difficult question to answer, but related to this is, what are some of the most vital mental health needs to address for priority populations who interact with the justice system? So interested on hearing your thoughts on that.
We actually have a great comment in the chat that came in as you were reading the question from Sam. I can just read it out. So kind of tying the two together, but having a fulsome understanding and proper diagnosis of intellectual and developmental disabilities has a big impact on the likelihood of interacting with the justice system, specifically from youth to adult services. If there are no proper diagnosis, they are not linked to appropriate supports to mitigate risk early, and agencies are usually playing catch up on these individuals later in life. So I think this is, I'd love to hear more from Julie and Crystal, but also from the audience about sort of addressing the needs of those who are underdiagnosed and who end up in the justice system.
Thank you, Sam, for that comment. I was just seeing if anyone else would jump in because, I don't want to take up all the airtime, but I think that's really important. And something that we are hearing is like, often in the community, people aren't being diagnosed or getting the services that they need, which increases the likelihood of interacting with the justice system. So this is something that we've been hearing a lot of and trying to think about what are proposed solutions for, getting that diagnosis early, what services need to be in place. So I don't want to jump ahead, but on the next slide, we do ask about, do you have any kind of promising practices or programs that you're aware of that work well? Because, we know that a lot of these things are known already. So we don't need to reinvent the wheel. It's a lot about scaling up what is working. Sarah, I see you have your hand up.
Yeah, I kind of have a similar but related question, which is that in the work that the Mental Health Commission has done, what has been sort of learned about how people can be supported when they don't have a diagnosis. Like, why does a diagnosis always have to be the front door to support? Obviously, I recognize that, you know, certain things are catered to that, but certainly all kinds of the support that people get is beyond their specific diagnoses. And I wonder if there's work that the Mental Health Commission is doing to address that.
Good question. So I wouldn't say specifically that we've been doing work on that, but it's something that we've been hearing is that, you know, requiring a diagnosis or even a referral to services are both very big barriers. So I think that's something that, you know, maybe with the action plan, we can have specific recommendations about that. And I understand the need, again, like you said, that sometimes you do need that diagnosis, but I think we need to get creative on, you know, providing services maybe where there isn't a diagnosis, especially because, you know, it can take 6 months to a year to see someone who can diagnose you. So then during that time, you can't have access to the services. And then, you know, if you do get diagnosed after that, you can wait another 6 months to a year to receive those services. So I think that's a big barrier. Nikki, I'm not sure if you had anything to add on that.
Yeah, it's just so challenging, especially the overlap with justice institutions who for the past, many of them, I know that different provinces and territories are different, but especially at the federal level and in certain concentrations at the provincial level, the focus has really been, you know, increasingly punitive, and untreated mental health considerations are then received and responded to through, you know, loss of liberty, loss of movement, the practice of chemical restraints, these really harmful processes that then make the conditions people experience worse. And as Alyssa commented, compounding that, there's not a systemic recognition of the impacts of these conditions. So as people are coming into systems of incarceration, we're in extreme states of grief and loss. And so without a systemic and a broad focus on that, the individual response, the onus is put on the individuals to kind of deal with it, that it's part of the experience. Again, it's been normalized, and that has tremendously negative impacts. Sorry, Trevor, I know you have your hand up.
Yeah, no, I was going to answer the question that's on the screen. Most vital mental health need to address priority populations who interact with the justice system. Although some people may question whether it's a mental health need, but housing. It's very definitely a mental health need, and it's something that comes up repeatedly. I'm sure you've heard it many times, but, you know, right now, a lot of people who are in and out of the justice system, especially people frequently in and out of the justice system, are people who aren't housed or aren't properly housed. And I think that you'd find they'd be less frequently in the justice system if they actually had a roof over their head, at least, especially one they call their own. And so not even, you know, a shelter bed or something like that, but an actual place to call their own. I think would do a lot of good for them. And the same with, you know, the hospitals as well, because right now housing tends to be hospitals or jails. So yeah, that to me is probably one of the most vital needs to address for people who interact with the justice system.
Thank you, Trevor. And I think it's definitely related to mental health, and it's something that we've been hearing a lot, kind of that we really need to look at, you know, the housing crisis and the affordability crisis and how that has an impact on mental health and, you know, likelihood of interacting with the justice system. So definitely something that we've been keeping top of mind. I do see, Kim, that you have your hand up.
Yeah, I do. And I apologize. Folks were in and out of my office. I should have probably stayed at home to watch this. But I'm interested in, I believe the slide said, like, in particular, the NCR. And if you can just speak a little, because I find, you know, and I always speak to this triangle about justice, community mental health, and the hospital, and folks kind of that are really not well, and the acute folks that we're supporting. And, you know, sometimes not being able to stay at hospital, coming back out, a safety concern to the community, and then you see them and they need mental health treatment, right? And it's just this revolving. Yeah, so I'm interested in more of that, and I know you guys were speaking about that, and I saw the slide, but yeah, I'm interested in more of that.
Thank you, Kim. Yeah, that's definitely a big focus. And something that we've been hearing too is that there needs to be, something between kind of justice, like the justice system, like incarceration and NCR. So we're hearing that there needs to be an alternative. So we've been hearing that. And I'm not sure if I'm understanding correctly, but also you're saying like there's the safety aspect, but also like the person health and mental health needs need to be met. Is that what you were trying to get at?
Yeah, I think the conditions of our environments right now with housing and substance use and tainted supply of substance too, that folks not necessarily knowing what they're taking, people know what they can take, and then it's where perhaps they show up at hospital, they stabilize, they're given something to stabilize, they end up back out in community, and here you have police attending, and not a good situation for folks where somebody in the community is going to get hurt, or that person is going to get hurt because there's just not that longevity of treatment, but maybe not that reason to form them. Perhaps not the NCR route, but where do these, and coming from, we're down in Peterborough and we have justice supportive housing, but it's really tricky to provide that high level of support when it's maybe out of our scope for those acute cases, right? And with individuals presenting with really complex needs.
Absolutely. And I think, I know we only have a few minutes left, but I think it is so important to have like those wraparound services, but also that continuity of care. And that's something we've been hearing a lot, and trying to look at, throughout the country and see like, are there promising practices where there is that continuity of care and there is kind of the services available. So I don't have an answer for you today, but that's definitely something that's been top of mind. It's something that we've been thinking of. And, if you have any suggestions, like please feel free to reach out. Maybe, I know there's some comments in the chat, but I don't want to go over time. So maybe we'll just go to the last slide where there is this QR code that you can scan, and I can put it in the chat. I just wanted to highlight here that, if you have any comments or you want to connect with us, you can scan the QR code or click on this link in the chat. And at the bottom of this image here, you can see email us. You can contact us anytime if you want to, meet to discuss more one-on-one. There's also a link to our survey at the top here that is closing next Wednesday, unfortunately. But, if you have time, please fill that out, and you can see some of our other resources that are listed here. And yeah, just thank you so much all for your participation. I think Anna is going to share the link to the evaluation in the chat, and I'm not sure, Anna and Sarah, if you have anything to say to wrap up, but I just want to thank everyone so much for your participation and feedback, and you've given us a lot to think about, so thank you.
Thank you so much for a really important and informative presentation, and we're obviously looking forward to next steps. Thanks everyone in the audience. I just want to remind you to fill out, pardon me, an evaluation for the session. It helps us know sort of what you've learned today and to think ahead about our conferences in the future, and it's also great feedback for the presenters. So you've got a bit of time now before lunch to do that. Okay, thanks everyone.